This is the September 12th, 2017 Radnor Township School District Policy Committee meeting. And let's see, we're going to get right underway because I think we have an hour. So I'd like to jump right in with introductions and administrative remarks. And I'd just like to set the stage that a few weeks ago I took a look at all of the various public comment questions that have been asked since I became chair. And I asked the administration to review and give us an update on the ones that I thought were pertinent to policy. So I'm hoping Dr. Robarczyk's beginning will feel that various comments and questions that have been asked in the last few months are getting addressed.
Yes, good evening, everybody, and welcome. So for tonight's meeting, I thought I would start with those questions. We had 4 of the questions that were on the table that were kind of stand outright and that we wanted to address immediately. The first one is the question in regards to the right to know and bringing the solicitor into the conversation. And basically, it is the administration's, if the administration believes a legal review is necessary at that time to be covered under the right to know procedure, a request will be made from the board secretary, Michelle Dico, in regards to have the solicitor review that right to know and determine provide any guidance that may be necessary.
Real quick, it's just ultimately it's administrative prerogative.
Correct.
Superintendent prerogative.
Yes, it is.
Thank you.
In regards to job descriptions of the new organizational chart, yes, job descriptions are being developed and are being correlated to that new organizational chart. And at some point, these will be obviously made available to the public and everybody, but we're just finishing up, putting some fine-tuning to those. In regards to cross-referencing policies, we do realize, I don't think this is anything new to myself or the committee, that we do have some cross-referencing that doesn't match up very well in some of the older policies. So we are, the committee is currently conducting a thorough review of those all of the adopted policies. If you recall, a number of them are 2008 PSBA boilerplate policies that were adopted at that time. So some of the cross-referencing, I think, just got in the way of the old ones with the new ones and new policies and old policies. So we are going through and we are going to address any of the cross-referencing that is not accurately documented on any of those. There was a question about addressing and grooming policy. There's one for students and support staff. And right now, the answer is basically no, there is not a policy that exists at this time for professional staff or administrators. And if the committee feels necessary at any point to look further into that, we can. We are bringing forward 2 policies tonight. Policy 121, which is curriculum-related field trips. This is being presented for a second read and hopefully adoption at this month's regular business meeting. The policy outlines the process of requesting a field trip, the procedures of gaining parental/guardian approval, the cross-referencing of policies regarding volunteering and medications, and then shortly after this is adopted, if it moves forward for second read and adoption this month, an AOR is in the work of being developed, but will be made available shortly after the policy is adopted to ensure that we capture everything that's in the policy. Policy 210 is the second policy that's being brought forward tonight, use of medications. Again, this policy is being brought forward to the committee. Just a reminder that after approving it as a first reading at the August 28th meeting, there were some revisions made at that time, so we rescinded the other one and moved forward with the one that had some revisions on it. But tonight we will be looking through that policy again. It has been vetted through our solicitor as well as the district certified school nurses to assure that the required information is included and can be carried out. So, again, I'm requesting that policy be brought forward for a second read and adoption at the September regular business meeting. And again, same thing, the AOR is being developed, and with the changes that have been and the revisions that have been made, will be incorporated into that administrative regulations.
Okay.
Susan, may I say one quick thing? This is a very hard-working committee, and I commend you all for what you've done. I do happen to know, because she won't say it herself, but Susan spent the entire Labor Day weekend looking at minutes of every policy meeting dating back to 2009, just to make sure that all of that stuff that had been brought to our attention that needed to be addressed was addressed. So she wouldn't say it, but I just thought everyone should know
Yes.
That's
Amy
not
has
exactly
made it
the
clear
way.
I have no life. And with that, let's move on.
I wasn't going to say it, so I was, for that
my
reason.
weekend that way is what I was going to say, but you did, and I was duly impressed.
All righty, so with that, if we could have the first public comment? And we have the guidelines for meetings and public participation on the entrance table, and hopefully everyone's had a chance to sign in. Yes, I labored. Welcome, Mrs. Spurtle.
There we go. I thought it. Cindy Spurtle, 106 Valley Forge Terrace, Wayne. Good evening, everybody. Thank you for answering the questions that were presented in the prior meeting, although some of the answers we still have questions on, but thank you for addressing them. As far as what's on the agenda this evening, on the first policy, curriculum-related field trips, the question I have, which has been asked in the past, and that's on the pricing of field trips and when a policy will be put together. I know that has been handed over to the Finance Committee before I get an answer to that. But my question is, are you going to follow up on it to see that it will be completed, and when do you expect that it will be completed? In the purpose, just going through and reading the first paragraph of curriculum-related field trips, I just noted a few things that might help in reading through that first paragraph. The board recognizes that field trips, when used for teaching and learning, are integral to the curriculum, adding the word are educationally, no?
No.
And learning integral?
No, teaching and learning integral to the curriculum.
Oh, then a comma. Then a comma before, after learning.
I don't think so.
Okay. And are an important component of the instructional program? I'm not going to argue. It's just my way of reading it. Under the authority, the third paragraph up from the bottom of page 1, it says that the no employee may solicit district students for such trips within district facilities or on district grounds without board permission. Now, at the beginning of that paragraph, it says that the board does not endorse, support, or assume responsibility for any district employees. With that statement, to me, I would ask, why would you give permission if you didn't support such trips? Or why would, it seems to contradict. And then the other question is, Mr. Rybarczyk said that the AR would be forthcoming. My question is, when will it be released to be added to this policy? And on the policy 210, use of medications, the back page, top paragraph, page 404. The top paragraph mentions that the district will have the naloxone nasal spray available. My question is, will it be available in every school or middle and high school, nurses' offices or medical room or whatever is available, or is it just going to be available at district offices? It's not clear. And it also says that those who will be administering the naloxone will complete, that they have, providing they complete an online course approved by the district, are they going to be required to take this course? And that maybe should be stated in the policy. Thank you.
Judy Sherry, Governor Circle, Newtown Square. There was a comment by the administration about right to know, and I know that it's at the discretion of the administration and I guess the board whether or not to send it to the solicitor. I'm just wondering, and I just like a ballpark number at some point, what percentage of the requests are sent to the solicitor? And I guess is there a criteria involved in that? And then it's good to know that there are going to be job descriptions, and it sounds like they're almost finalized, so I'm wondering, will they be available by next month? And the comment about the cross-referencing of existing policies. Just want to be clear, this is not necessarily just cross-referencing. This is referencing policies that are no longer in existence. So just to be clear about that. And these policies, I don't have my last month's comments, but they were brought to the board a long time ago and to the administration. So, I think some sort of timely response about the policies that reference non-existing policies should happen in this committee. And so I'd be interested in knowing the time frame for that. And one of my questions was, are district professionals trained to recognize opiate overdoses? Because it sounded at one point like that was part of a response that was required. So I'd like to know what kind of training they get in identifying that. And I'd also asked about the policy for graduation requirements. The fact that we don't have an AR that shows kind of more specific requirements. Maybe it was because I also took a look at TE's requirements that were listed, and the fact that they added a course requirement of college and career transition. So they require 24 credits. We require 22.5. And I wondered if the board is just going to take a look to see if that is, the standard they want to go by. It might be a fine standard. I don't have any feelings one way or the other, but there is a difference there. And also, I would like to know where we are about funding the field trips. I know that was pushed to the Finance Committee, but should be addressed by the Finance Committee and coming, I assume, back to this committee for final approval, or does it go directly from the Finance Committee to the board itself? I don't know what the plans are for that. And my final, comment is about sports concussions and injuries. And I wonder, does the board require the administration to track sports injuries, both the nature of the injury and the sport where it occurs? And still, is there any consideration by the board to limit activities such as tackling to reduce sprain injuries? There's an article that I would like to point out to the board today that says, "Take a pass on football, surgeons urged." It's in today's Inquirer. Orthopedics Journal editorial says they should not take team sponsorship. And if I just have a minute, I'm just going to read a couple of paragraphs from this. Orthopedic surgeons should disassociate themselves from football at all levels of the sport rather than enabling an activity that carries a risk of brain injury, according to an editorial by senior editors of a Philadelphia-based orthopedics journal.
Mrs. Sherry, could I ask you to just perhaps give us the name, the date? I saw that article.
Day's paper.
Yes, I saw it online today in Philly. So,
Yeah.
I'll
As I said, I'm not going to read the whole thing. I just wanted to read a few
We have a very full
things.
agenda, and the meeting ends at 7.
Thank you.
So I'm going to ask you to finish
Yeah.
now and not continue reading. We're happy to have the article distributed to the entire policy committee. We have a very tight agenda.
Yeah.
We have an hour.
I'm going to just read the last
Mrs. Sherry.
paragraph. Am I within my 4 minutes? I don't think I've gone over my 4 minutes.
I think you have.
No, I don't
You
think
have.
I have. Who's monitoring it? Oh, and how far over it am I?
You're at 5 minutes, so you're 25%.
Well, the last minute was spent arguing over me reading the last paragraph.
Okay, so if we could just stop, and I don't know if Dr. Winters has a comment, and we'll go from there.
I have two questions, and perhaps they're better addressed in administrative regulation than in policy, but it has to do with the guidelines for the medication. If you look at page 2 of 4, the parents are supposed to complete a form. I'm not sure where those forms are located, and I think it's important if you have a child who has a medical need, you know where to get the form so you can fill it out, if they're in the office or in the nurse's office or in the student handbook or wherever they are. And the second thing is, I believe it would be prudent to perhaps have a list in the schools or in teachers' desks of those personnel who are authorized to deliver naloxone prescription, because it says it has to be delivered by an authorized personnel. I would hate to not be able to find one fast.
Thank you, Dr. Winters. Okay, so has everyone had a chance to look at the minutes of the July 11th meeting? Are we good to go with those? Yes? Great. So with that, we're going to get underway with agenda item number 1, field trips for a second read. I would like to, before you get started, Dr. Grabarczyk, just to clarify the question in the public. If the sentence is read without the phrase that's in the commas, the board recognizes that field trips are an educationally sound and important component of the instructional program. The phrase in there that qualifies when field trips are considered curriculum related is the phrase, when used for teaching and learning integral to the curriculum. So that's the reason that it is an entire phrase that separates when and qualifies when field trips are an educationally sound and important component of the instructional program, such that they are called curriculum-related field trips. So I stand by the language as it's read here. Thank you, Dr. Grabarczyk, for working on this. And with that, I think we can maybe just see if there's any further questions or concerns
Sure.
about
At this point, as I said, this is being brought forward, presented for a second read and adoption at this month's regular meeting. It does outline the process and procedures for doing participating in field trips, curriculum-related field trips at the schools. The one thing I did miss in my opening comment, which I apologize, but it was to be noted the policy is not intended to give any direction of the financial components, as we know that we move that on to financial. Okay, I just wanted to make sure. So any other questions regarding 121 curriculum-related field trips?
Are we good with this?
Yeah, just because it came up, the paragraph, the board does not endorse, support, nor assume responsibility in any way for any district employee. Is there perhaps an example of when that occurs so that it could eliminate the confusion, since I think it has been mentioned a couple of times? Like, what kind of circumstance would that be?
So it might, well, I'll let you all take. I can think of one, but I'll let you.
Yes, there is one that comes to mind. There is a teacher that does a summer trip that is not associated with the district, but does their own thing. And that's all through the approval of the parents and through that individual, not as a member of the Radnor Township School District, but rather as an outside individual. So that would be a part where we don't endorse it. We're not assuming a responsibility. But at the same time, no employee may be soliciting. They don't do it during school hours or anything where she's looking to offer the trip for students. It's all done after hours of outside the contractual obligation.
Or with board permission.
Or with
you
board
can't
permission.
do that without
Correct.
board permission.
Correct.
So I think that,
You're not mic'd.
sorry,
There you go.
just keeping it secret here. So I do think that the two sentences stand on their own, though. I think, and they're also equally important, right? So we can't assume any responsibility where we have not given the approval.
Correct.
And then we're also in the second sentence, which I think is a completely separate thought. No employee may solicit without our permission. So I do think they stand apart, and I think they each serve a separate role.
The other thing I wanted to say is that in looking through the minutes of the policy meetings from the last couple of years, when we did first start talking about Policy 121, early in the process, so there may have been some confusion, there was discussion, I read through the minutes, of talking about how field trips are funded. In subsequent conversations that have happened here at this meeting, we've just like supplementals, we've decided, no, they don't belong in this policy.
Correct.
And I have brought that to the attention of the Chair of Finance. I serve on the Finance Committee. You know, to anyone who is wondering when is that conversation going to happen, when is that work going to be done, it's really not the work of this committee. I've brought it to the Finance Committee, and questions about the timing on funding should be brought to the Finance Committee meeting, and then if they would like to send something back to us for review because they've developed a policy, I think that's something we discuss administratively. Yes, Doc? Yes? Okay.
So it'd be similar to what happened in communications.
Correct.
With Mr. Petiti developing a policy, communications policy was brought forward once it was developed.
Right, okay.
I think, and you're the minutes queen at this point, so I'm going to rely on you. But I think at one point in these meetings, we did discuss adding, and it maybe, I missed the June policy meeting, so maybe it was resolved there. But at one point, we were talking about adding in one sentence that at least sort of was directional and said, you had come up with wording, Susan, about the finances. Not that they were going to be outlined in here, but just sort of tossing it to finance so that anybody who had any question, like it comes out of the general fund, or, it's going to be at the discretion of the finance committee, or something like that. You came up with language, and if I
See, I don't think I did, and the reason I'll tell you that is that's something that we handle in the budgeting process. If we had a policy for everything that we fund in the district, correct me if I'm wrong, I think we would have a very cumbersome policy manual and a very cumbersome budgeting process. The reality is we have policies that say we're going to come up with a budget, we're going to set priorities as a district, and the budgeting process basically is that the culmination of our policies. I mean, Ken, you should speak to this more than I, but
I think maybe you are answering me exactly.
No. So I don't think it belongs cross-referenced in here because every policy about how we, when we choose curriculum books, we would have to say, and how those books get funded is through the budgeting process or through the finance committee. No,
Okay.
It's just inherently understood. The budgeting process is how things get funded. And now, and we are talking about having a conversation at the Finance Committee, which I don't know how they'll choose to handle it. How do they want to articulate how we prioritize the funding of field trips? Now, Ken, really, please, at this point, you should jump in because this is your district.
Yeah.
No, I think the movement that we have here and the recommendation for how this is worded is fine. I think we need to go back now and we can follow up with finance, where's the status of that review, and how that would be looked upon. I don't think it would be necessary to add additional language here at this point, but I think we need to, as a district, look at this has been a question that this is the reason why it's risen to the occasion that it's at finance now, is that we want to look at how do we fund field trips, and what is our practice and policy for doing that.
Okay, I apologize. Maybe it was resolved in June when I wasn't here, but I remember it was conversation that happened at some point. Okay.
So if we don't have further comment, Andrew or Andrea, do you have any thoughts on our field trips? Good. Okay. Then I'm going to ask that we have consensus to move it forward for a second read. Yes?
Mm-hmm.
Yes. Great.
Yes.
And with that, we'll go on to agenda item number 2. And because the question came up in the public about where do we find the forms, I think maybe Dr. Obarczyk, could you talk about the omission that we realized perhaps you've had a chance to talk to Mr. Christofko?
Oh, yes.
Paragraph.
Yes.
Great.
So we have in regards to the forms, they will be integrated into the AR for sure, implemented there. There are a number of different forms that have been created over the years that each of the nurses have. So they are working to narrow down to one form that will be used as part of for parents to be able to obtain and fill out their request for medication to be given in school.
And it's going to have a date on it, so it's clear.
And they'll have a date on it, right, along.
Clear that it goes with this policy.
Yes.
Thank you.
And we're going to cross-reference it to make sure that it's all information is included. There was a question in regards to under the guidelines. There was a statement that was in our present policy that is online and in our books about parents and the community members being notified of how the medication process and the permission for giving it to parents. So we want to make sure that we capture that again and put it back into where the guidelines were. I'll be completely honest, as I said, I'm not sure where it disappeared from May, June to now, but we will make sure that we put it back in. And did you find it at all?
I didn't find the original language.
Okay.
I know that the details of how that gets communicated to the parents and the community is probably best captured in the AR. I mean, I think that the policy could just have a general statement that would indicate that it is to be communicated, and then the detail of how that gets done should be captured in the AR, along with all the other details as to how the policy gets administered.
Yeah, I think the question that came up this weekend that we realized is that the existing policy, the first line of the guidelines, has this statement, and
Yes.
somehow in transferring over a clean copy from one administrator to another,
Correct.
Because a clean copy was transferred, not a red line, we didn't know that it had been deleted. There was no intention to delete this sentence because.
Correct. And the sentence says, the district shall inform all parents/guardians, students and staff about the policy and procedures governing the administration of medications.
Correct.
That is the piece that would be put back and start the guidelines for the new
Right.
policy.
Right. So I guess, Mike, my question to you is, what's the implication of bringing that back in at this second read time?
I don't think that that is a significant enough change to the substance of the policy that would require this to go through another first read process. Sorry.
Yeah, could you say that again?
Sure. I don't believe that that's a significant enough change. It would require this policy to go through another first read process. It's not really changing the substance of the policy. It's just saying that the district will make everyone aware of the policy. And it's not changing any of the actual mechanics or what the policy says or does. And like I said, I think that the actual details of how this gets carried out are better handled in the regulation anyway, because that will be the administration's duty to determine how this gets disseminated to the parents and students.
Okay. So do you have other questions? Because I would like to talk about the naloxone paragraph for a moment.
Can I just clarify
Yeah,
that one
sure.
piece? So in regards to the training that needs to occur, it's going to be a course that's through the Pennsylvania Department of Health, not anything
not
the
the
district creates. Just wanted to clarify that
Well,
piece.
so Tony, one thing that might clarify that is on the back page where it says Pennsylvania Act 139 of 2014.
Yes.
That really needs to go up a line or two because
Okay.
it is in fact that act that says we can have it in the schools and people can use it if they've completed that course. So we just
Correct.
wanted to be clear that it's not a district course, it's a course predicated and dictated by the state, I believe under that act.
Yes.
Yes. So, thank you.
And in regards to where the naloxone nasal spray will be kept, it will be kept in the high school. This is part of the Department of Health is doing a process this year where they will give you free doses of the naloxone nasal spray once you have a policy in place. But it is intended for the high school as part of the application only.
Okay. Are there other questions, thoughts, concerns about the medication policy?
Just along those lines, do you think the administrative, the AR will cover what to do in the case of an overdose when a nurse is not around?
Yes, in the layout of in the AR, definitely, of what procedures need to take place. But more than likely, it will be to call 911 immediately. And if there's no one that's been trained to give it, if the product's not available and the nurse is not there.
Did we ever get an answer, Mike, about the Good Sam laws? If we
that's
were
right.
covered with that?
Mike, yourself, please.
Sorry.
Yeah, sorry.
Yeah, the Good Samaritan laws only provide protection to somebody that's providing health care that they've been trained to provide. So if somebody were to do something that they haven't been appropriately trained to do, then they wouldn't get protection.
So like the AEDs, the heart defibrillators, we really shouldn't be touching them if someone gets sick unless we're trained on them?
Yeah, the Red Cross offers a course and as a CPR certification course, and as part of that course, training in those AEDs is provided. And so anybody that would have that kind of training, if they utilize the device on somebody to save their life and something went wrong with the device or what they were doing, they would be protected under the Good Samaritan law. I think it's a stretch to say that unless you've been trained, you shouldn't do anything to help the person because, I mean, it's very unlikely that you would do something that would exacerbate a situation if somebody was having a heart attack. But yeah, technically under the Good Samaritan laws, you're only protected if you're providing care that you've been trained to provide.
That's too bad, but thank you for that clarification.
I had a couple comments. One is that in the administrative regulations, will there be something that speaks specifically to a field trip when there isn't a nurse? I know there's language in here that says designated personnel, but I believe there was an incident this year where there was an overseas trip and there was a medication issue. And so given that that could come up again and it's happened, can there be something really specific? I think that's when you're planning to go on a trip, the policies and ARs get a little fuzzy. It might not be on the top of the list, but it's so crucially important.
Yeah, I'll work with Mr. Kane in making sure that that language is in there and what's required by law to make sure we're covering our bases for it.
Okay. And the other thing is that I was wondering, just out of curiosity, on page 3 of 4, non-prescription pain relief and antacid medication may be administered. In some schools, unless I'm imagining it, isn't an antihistamine also something that you can get permission to administer? And that may not be the case, in which case it doesn't belong in here, but...
My understanding is it's only the Tylenol or the Tums is the
Okay.
other medication. I was trying to think of the other word for Tylenol.
Okay.
Acetaminophen, there you go.
Okay.
So those were the two that can be given based on parent permission.
Okay. I also just thought it would be of interest, given that this, we're pushing this policy forward. I don't know if anybody saw the legislation memoranda that's come up about sunscreen. Anybody know about that? Okay, so I found that there's a bill, I think it's 1030, that's been introduced that to allow students at school to apply sunscreen or wear sun protective clothing without a prescription or doctor's note. It's a companion to House Bill 1228 in the House. It says in Pennsylvania, only the school nurse can administer sunscreen because it is considered an over-the-counter medication by the Food and Drug Administration. Just like Neosporin, students must have a doctor's order, not just their parents' permission, and the sunscreen has to be administered by a nurse. So I just thought, keep your eye on that bill.
This is already covered. We do this. So anything over I'm going to speak for the elementary schools. I'd have to check with the secondary, but this falls in line with cough drops, anything such as you now need a doctor's prescription.
You do?
Yes. You need something from the doctor that indicates that they need to have that in school.
Well, so do you think that everyone knows that?
I do. It's in our, in the handbooks and everything. But is it something that everyone follows? No, I wouldn't say everyone follows that, unfortunately. So it's something that one of those things, if we do see a student with a cough drop in school, we will send them to the nurse to make sure that the procedure is followed through.
You say everyone follows parents, you're referring to?
Pardon?
Parents you're referring to?
Parents, correct. Yes.
No, the administration follows.
Yeah, no, administration follows it. I didn't mean,
Like K through
No, the
12,
district follows
you
the rules.
can't-
district follows it, but
K through 12, like you can't send your high school student to school with cough drops?
you are not
legally?
supposed to.
I would have never known that. I'm just saying.
So.
I thought, that's interesting. Okay, and then the other just thing, if you're making modifications, I talked to Susan about this earlier. The purpose doesn't really feel like it's a purpose. To me, it feels more like a guideline or authority. And Susan said that if there aren't going to be changes made, then, this is for another day. But given that there are going to be some changes made before it goes for a second read, like reinstating that other line, I just wanted to mention that because I think purposes are important. I think when you read the administration will be permitted, that's essentially boiling down that first paragraph. To me, that sounds like authority or a guideline. So I'm not sure which. Mike could probably tell us better, but it doesn't really feel like a purpose. And so I was just going to ask if that is something up for consideration. Can we get a more of a purpose, I guess?
Tony, just to let you know, the feedback I gave Amy, and, I'll certainly take the guidance of the committee at this point, is I think that this is a policy that is likely to be changed periodically, just changes in law, this, that, and the other
Correct.
thing. And, I think that if what we could do now, so keeping the wording under guidelines that was never intended to be deleted
Right.
is one thing. Adding a purpose here, I think we are going to oblige ourselves to bring it back to first read. So what my suggestion would be is to make a footnote that we want to add a purpose the next time this particular policy comes up for a renewal or a review or a revision for some other reason. But I, welcome the committee's thoughts on that in terms of a process.
I agree.
Okay. Dave?
Yeah, I think if we're not going to make any other changes, I don't see rewording the purpose at this point as being critical to the functionality of the policy. But certainly a footnote and making sure that if it comes back that we address it, I think is prudent.
Okay, great. So let's do whatever you need to do. Add it to a spreadsheet or something, or we'll just, I'll remember it from minutes, or Amy will remember. One of us will. Mike, I'm sorry, Christofko. I do have one quick question, because I think it kind of answers a question with regard to this policy. It touches on something Tony just said, and actually addresses a comment that came up during the graduation in public comment. In some senses, our student handbooks are effectively ARs, correct? In that they are a reflection of district policy. So when we have guidelines in the student handbooks that are given to the high school, the middle school, the elementary school about all these various rules, medication, field trips, how you take the bus, all the things, how is that, walk me through. That's effectively the way we communicate policy. Yes, no?
Yeah, that's the way that you communicate policy relevant to students in the building, sure.
Okay, great.
There are a lot of policies that don't have, aren't in there because they're not directly relevant to that. But yeah, that would be the way that gets communicated to students.
Right. Okay, so why I'm saying that is, in terms of a process here, we're putting that language back in this policy to make sure we let parents know. Well, how we're going to let parents know is we're going to put it in the handbook. Now, Tony, I personally think because we've made some changes, it's probably warrants at some point, sending a flyer home or letting parents in the elementary schools in particular, but maybe all the parents know, hey, here's the new forms to utilize for medications. It's brought to their attention. I think it's probably relevant enough. But the handbook is how we are going to, in the future, next year, what have you, let parents know what the process is about medication. And why I'm saying that is our graduation requirements, because there was a comment, there's no AR. Well, there doesn't need to be an AR. It's in the student high school, it's in the program of studies, and it's in, I think, the student handbook, one or both of those. So there's no need to have an AR because we've put it in our handbooks, which are the work of the district, right, and reflect policy.
Yeah, the handbooks are regulations put out by the administration that capture the district policy and set forth the details of that. Okay,
so you're going to...
And just to clarify your comment in regards to communicating this to parents, it will be handled the same way we did with immunizations.
Okay.
I already spoke with Mr. Petiti in a communication plan, and now we're going to get the message out to everybody.
Okay, so Andrea, you're a teacher. Andrew, you're a student. You guys maybe care about medications. Do you have thoughts, comments? How does this land for you?
I'm not gonna lie. I didn't know about the cough drop thing either.
Okay.
We do send kids. Kids will say, "I need this or that," and we send them to the nurse as a teacher. As a parent, I would send them in with my kids. So I did not know a lot about that. So I think that clarification is good because I think a lot of parents do it. And don't know that they shouldn't be sending in a cough drop with their kids.
Okay.
Some simple things like that, because kids do have them at school.
I can definitely confirm that kids, especially high schoolers, have cough drops.
Have cough drops.
You might have to lock me up. I have a thing of cough drops and Advil in my backpack. So I have to plead ignorance there. So maybe that needs to be relayed to the students more, that you can't do that.
And you can relay it, but know that it wouldn't deter Andrew. And I will tell you,
Correct.
I know all of these
Right.
policies, and guess what you would find in my kids' backpacks? There are other rules I break willingly, knowingly. So you can tell them just to check off the box that you told them.
Right.
If that's what we need to do.
But that's kids and rules in life.
Yes.
The reality is this particular law about no medications, no cough drops, it wasn't created by us. This is a state rule.
State Department of Health.
This is not
Not
district.
us.
This is not our idea. We did not
So-
think, we didn't come up with, hey, let's make it really
Correct.
hard for Andrew to deal with his cough, because that's
So
not
can you
what we
just
did.
clarify for me then, is there going to be something that says, or is there something I missed that says that things like cough drops and sunscreen are considered medications that only are administered by the nurse? I'm confused.
But we
No, I think
can,
we should clarify.
send, as we communicate this policy, the new procedures, we can send home, basically because the only two things that are allowed, if you think about it, are this, to sign off for Tums and Tylenol. That is it. So anything that doesn't fit within those two that you haven't signed off for, you're really supposed to send in with a doctor's note that's over the counter.
I think the
So,
issue is
that's-
that I don't think that there are people who consider cough drops and sunscreen
Right, exactly.
medication.
But then
That's
you,
So we
then it
clarify.
invites the issue of when my younger children especially go on field trips, they are instructed to bring sunscreen. So there's a conflict there. 'Cause
There is. It's
is the
not an
nurse
easy
constantly-
situation. I
Is there a whole
understand.
day spent rubbing down little
rubbing
kids?
down, putting
Oh,
on sunscreen.
right.
The
So-
spray.
Right.
We don't want to do that. So I just gave the example. So we're going to pretend no. But no, we will make sure we communicate this out, and we'll even be specific because that goes back to a law that was how long ago? That was probably 4 or 5 years ago, where that law came out, where they changed the medications from the Department of Health.
By the way,
And-
there is a legislator who is trying to change the sunscreen law. So hopefully this will be all for naught.
So, all right, but I will definitely.
And Anthony, I do think it's important. This is a particular AR that I know that it's mostly written because we saw it in
It is.
June. in
But because
AR
of the
form.
language changes that we've made with healthcare provider and those
Right,
type of
I get
things,
that.
it just needs to be reviewed again.
Right, but I mean, it's got to be at the top of the priority list.
Correct.
Okay,
Yes.
great. So with that, if we don't have any other comments about the policy, can we get consensus to move this forward for a second read?
Yes.
Yes.
Great. Thank you.
Okay. So I'm going to take, pardon me? Yep, new business. What I'd like to do for new business quickly before we have the second public comment is to, because it's been on the mind, yes, the intention is to have the cross-referencing done at next month's meeting. So really, the background is that what we came to learn over Labor Day weekend is that when the PSBA policies were adopted en masse as an entire manual, there was actually a board motion that night that deleted and certain policies. So they were part of the manual, and there was a specific motion, and there were a number of policies that were never passed that night as a part of the manual. And at the time, and I was not on the board, at the time, I guess it didn't occur to anyone to go through all of the policies that were passed and delete the cross-referencing of the policies that were not passed on that night. And so we've got a list, we're going to go through that, and that is how that came to be. The mystery is solved. And we've spoken to the solicitor about the way to handle that, and the intention is to put that on the agenda and handle that at the October meeting. And then, some of these other questions, we will, I'll defer them to the administration and endeavor to have some answers next month. I will say that not all questions that are brought to the policy committee are actually relevant to the policy committee, but I certainly encourage the public, if they don't get an answer that they feel is complete here, I would direct them maybe to a different committee. For instance, the funding could go to the finance committee. And I think depending on how you look at it, I can see how sports concussions and the tracking of injuries could be policy or could be curriculum. But Mr. Batchel, maybe you can tell us your thoughts on that.
Sure, and actually, I think that question was raised at a curriculum committee earlier, and I know curriculum is planning to, respond to that question. So we'll make sure that the question from tonight about concussions, again, reaches the curriculum committee as well, and they'll respond to some of those questions.
Yeah, because what I'd like to do, why it's good to have the administration vetting it is there's really not a need for 3 different committees to address a question that might only be relevant for one committee to answer.
Sure, agreed.
Okay, great. All right, so next month we'll have that en masse correction, and with that, we have a second public comment.
Actually, I have a question.
I'm so sorry, go ahead.
That's all right. Tony, we had met and talked about how the administration was interested in reviewing the booster clubs and administration of it. And as a parent as you may know, it has come to light to me that we have what I interpret to be a serious problem that, Ken, I'm so sorry you've inherited regarding Radnor requiring children to put money into a booster club that we have zero oversight over. And it's a very large booster club in terms of child participation and money. And I'm alarmed. School has started, and we are getting ready to have children and their parents put more money into this club within weeks. And I'm alarmed. And I'd like to know if anyone shares that sense of urgency with me, if what we can do, is this an issue of developing a policy to cover this, and what we can do in the shortest time frame possible, because it's a big concern for me.
It's a good question. What we have, I believe, and I can't speak for all of our booster clubs, but I know many of our booster clubs do charge a fee. So many of our booster clubs will charge a fee, and those fees range from supporting that particular athletic activity or non-athletic activity that booster club is part of. It ranges from supporting for outfits for kids or things for the end of the season or end of the activity, for different kinds of awards or recognitions. So the particular club, in the case of, as you brought up, one particular club, we are actually, we have a great sense of urgency just to look at it as the start of the year, and to really look at what has been the structure that we've established both as a district for oversight of our booster clubs, and then how have we set up that structure maybe differently depending on the activity or the whichever the activity or athletic clubs that exist. So that is something we're looking at very closely right now. Our business manager is actually meeting with some of those with one particular head of one of the boosters to look at how did that structure was developed over the years, and then what would make the most sense for us moving forward. And I think administratively we can bring forward and share, our recommendations. I don't know if it belongs in policy. Again, back to that question we were just having before, will it belong in policy ultimately with the recommendations? I'm not sure. I probably, may really fit probably under curriculum more because it deals with so many co-curricular activities. But it's something that we are looking at with a sense of urgency in this one particular case for this year.
So, Ken, I wanted to let you know, over the weekend I noticed, I was looking through we get a PSBA magazine, I think, once a quarter, and the June one actually has an article about this, about boosters, and so I ripped it out, meant to bring it, forgot, but I will give it to you guys. It just had a lot of, at the state level, and at the school board level, kind of high-level thinking about all sorts of issues with booster clubs and ways to think about them. So I'll drop off the article because it was interesting, and I think it might inform. We don't want to develop. I'll speak for myself personally. I know that you want to take the approach as kind of what's a good process, what are good guidelines, kind of regardless of the booster club, not have it be about one club or another.
Right, and our concerns, and I want to be careful as I preface it with the term concern. I want to say that, boosters and the people that are involved in booster clubs, me being involved in booster clubs with my own children in their district. I mean, so many of the boosters and the booster leadership give countless hours and time and energy into supporting, Radnor athletics, Radnor activities, and we so appreciate all that they do to support all of our different activities. But there is no district, this is not a new issue, about, how do we make sure that what's going on in our booster clubs and how they're supporting it is consistent with what we as a district would like to see happening within that activity. And I think that we as a district need to make sure that we partner and we understand what has taken place. And we also look at what we may have put in place years ago, too, that could have established some of these procedures, rules that maybe we want to now, 7-10 years later, start to reevaluate.
And I want to point out, make it very clear, I do not suspect wrongdoing. I do not know of wrongdoing. This is not where this is coming from at all. I am coming from this as a parent, partially, because I have to write out 2 new checks again very soon. So it's my money, and I, as a school board member, it's many other people's money, and I'm very concerned. I appreciate looking into it like this. It's without a timeline, though. some sense of what we can do, even in a stopgap measure, I'm not that comforted by what I'm hearing tonight. I'm sorry.
Well, I do know that, let me give you this article because you might find it helpful things to think about. I wouldn't have used the word concern. I think as a district, in a completely different way. I've told you I've been a treasurer for many, many, many different volunteer organizations. As a district, if we develop best practices of how booster clubs could operate in our district, and everybody has a clear communication and a clear understanding of what the district would consider to be best practices, then that's just good, consistent information for everybody to have across the board. And, we should endeavor to do that as quickly as possible because, I think
Agree.
wrongdoing or, no wrongdoing aside, I don't think there is a clear communication about that. So I'm picking up on Amy's clear communication. I'm picking up on Julia's best practice. Dave, what's your line? What do you like?
I'm just hanging out with you guys.
No, I'm saying if we have best practices in place and we clearly communicate them, then it's good for everybody.
I would agree,
Yeah.
and that's the goal.
Yep. All righty. So with that, we're going to have our second public comment, and I welcome everyone forward who would like to speak. Gotcha. Because I'm about to get
Hello, Judy Sherry, Governor Circle, Newtown Square. Regarding the, which I left my other page back there, but regarding the personnel who are able to administer the medicine for the opiate of naloxone. Does the administration keep a list of those personnel that are able to do that have taken the online class? And what sort of percentage of the employees have taken that online class? I think I left all my notes behind, but I did want to read, now that I have extra time, the related to the comments about the booster clubs. I would like to point out to board members that the administration does not control any of the football information that appears on the website. You have to go outside to the booster club to get information on the football team. And is that really the appropriate way of getting information about a high school team? So I don't know which organizations, which booster clubs require students to pay, but it certainly sounds like pay to play to me. Which, is that the way a public high school should operate? I would question that. And getting back to, again, the concussion issue, which I mentioned before, I did want the board to realize that these orthopedic surgeons said that typically physicians do not support the continued exposure of patients to known severe avoidable harms while approaches to risk reduction are evaluated. They wrote, "Our first responsibility is the health and safety of our patients." And I would say to board members that that is your first responsibility too, to the health and safety of your students. So I would hope that you would reflect carefully on that and really think about what kind of efforts can be made to make sure that the students going through the school now will not suffer the consequences of sports practices that will contribute to brain injuries. Thank you.
Good evening again. I just wanted to encourage that the forms that need to be filled out for the medication to be administered by the nurses be put in a significantly visible place on the website so that when people go to the doctors and they have an issue, that it can be filled out right there, because most people can access these things on their phones, or the doctors can have them in their offices. So please put those forms on websites. It would, I think, would save a lot of inconvenience. The second point I would like to make is, since you're talking about future discussions, as you've done, since I've been involved in looking at the research involving student sleep needs, one of the issues that comes up that does not involve changing student start time that could be done is to have a homework policy that is clear and consistent and enforceable. And I know while we have a policy, I'm not sure it is really firmed up as yet, and I think that's something that could be done. I know it's been worked on a while, but I think they're probably, I don't think the administrative regulations were put in place or whatever it was, but I think it needs to be looked at again.
They are in place and they're posted.
Great.
And we started with Mrs. Spurtle. Well, I'm with Mrs. Spurtle.
Thank you. Cindy Spurtle, Wayne. In my question that I had on the healthcare personnel required, I understand that it's not, the course, approved course is not a district mandated course. That I know. Okay. And I did read all the way through the paragraph that comes from the Pennsylvania Department of Health. My question, I guess, was that are nurses required, or because they have the training to administer this, they don't have to be required to take the course? That's where I was coming from healthcare personnel. And also on the ARs, of which there have been questions on when the AR will be ready and completed. It's my understanding, listening to the discussion through the whole meeting, that ARs are provided online, and maybe the policies that have accompanying ARs would state in the policy that the ARs could be found in the student handbook, which is online. Then the parents will definitely know where the rules are. Is the student handbook online? I believe it is. Yeah, thank you.
Okay, do we have any other further comment?
One more question. Sadly, the naloxone is going to be provided, and if I understand correctly, to the high schools, because it's been given to the school district so that it will be provided in the high schools. My question again is, why not the middle school? And that's a sad question, but that's where the use is happening that young. Thank you.
Thank you. Okay, so with that, we are adjourned.